Welcome to CBCLIPS. In this episode of CBCLIPS, I show you the imaging and surgical findings of a baby girl with a very proximal jejunal atresia, and I ask you, how would you manage it? Several question the need for a contrast enema prior to surgery, and I agree. A patient like this can proceed to surgery without a contrast enema. However, I still find a contrast enema very useful for any obstruction distal to the duodenum in babies. It helps confirm the patency of the colon. It can still rule out meconium-type obstructions, and in this case, it shows a microcolon, which is very common, of course, in cases of intestinal atresia. However, when you have a microcolon with a very proximal atresia, you can almost predict short bowel because there should have been plenty of bowel distal to the atresia to fill that colon. When you operate for intestinal atresias, I think there are three important principles. Number one, consider what is the best option to establish early bowel continuity, because that relates to the early morbidity, needing to feed the baby early and avoid early problems. Second, what is the best method to preserve absorptive capacity and bowel length? And that's very important in a patient like this with short bowel. And third, what is the best option to deal with dilated bowel? Because this is what we call the latent morbidity, what we see in teenagers and adults sometimes who've had congenital bowel obstruction and dilated bowel. In this case, I performed a simple jejunal ileal anastomosis and put a gastrostomy, and I believe it addressed all three of these issues. It established bowel continuity early, allowed us to feed the baby. It did not sacrifice any bowel length, including bowel length that may be used for stomas and their takedown. And in this case, the bowel was not dilated enough to do any plication or lengthening. So it allowed the bowel to dilate more. And in fact, this baby was on TPN until well into her second year of life. But at about 1.5 years, we did a step procedure. And by 2 years, she was off TPN and on complete enteral feeds. It has since done very, very well. Thank you, and until another CBCLIPS.